talk about leprosy, which is caused by Mycobacterium leprae. Keeping with our Mycobacterium in the Wild West themes, this sketch will take place at an old western jailhouse in Armadillo County, and we've titled it The Good, the Bad, and the Lion-Faced. Okay, let's start with some general characteristics. You'll notice that there's snow on the ground and icicles on the buildings because our scene's taking place in wintertime. And the reason we have it taking place in winter is because leprae thrives in cool temperatures. And you'll see later this gives it a predilection for the extremities of the body. But we'll talk more about that when we talk about clinical presentation. Since leprae is a type of mycobacterium, this means that it shares some of the same characteristics with tuberculosis. And mainly, that's that it's an acid-fast bacteria. So this, of course, means that we're going to bring in our acid-fast gunslinger to the scene. And just as a quick review, the tassels on his cloak and chaps are to represent the mycolic acids, which are made up of waxy chains and are responsible for taking up the acid-fast stain. And to remind you that this acid-fast stain is comprised of carbonyl fuchsin, you should remember that our gunslinger slings a fuchsia-colored gun. And to wrap up the general bacterial characteristics, an important aspect of leprae that you should definitely know is its reservoir. In the US, the reservoir is actually the armadillo. Pretty random. I did mention, though, that we were in Armadillo County, and this is the Armadillo County Jail. To drive it in further, we're going to draw a little armadillo down here in the front, and his name's Hansen. Why? You may also hear leprosy being referred to as Hansen's disease. And in some parts of the US, it's even referred to as bop-a-dooba-dop disease. Okay, now let's move on to clinical presentations. It's actually somewhat tricky because Mycobacterium leprae really has two separate presentations that are distinctly different in terms of pathogenesis, but also in clinical presentation. And these two forms are called tuberculoid and lepromatous leprosy. So this is what we've done for you. We've divided the jail into two separate jail cells. And we'll start on the left with jail cell 1. And here we're going to discuss the tuberculoid presentation. Now the number is meant to represent the type of helper T cell that's involved with the immune response to infection. So jail cell 1 is for Th1 cells, which promote cell-mediated immunity. So with the strong Th1 response, the body can contain the bacteria within macrophages. So how can we portray this? Remember, in past drawings we used cages or bars to represent being inside macrophages. So we'll do the same thing here and have a prisoner behind bars on the Th1 side. And this represents macrophages engulfing the bacteria, as in cell-mediated immunity. And symptoms of an infection controlled with cell-mediated immunity are relatively mild. And the main symptom you'll see in this type of leprosy is this well-demarcated, hairless, hypoaesthetic skin plaque. And to portray this, we've given our prisoner a well-demarcated bald spot on the top of his head. But just remember, this can occur anywhere around the body, not just on the scalp. Obviously, not all bald people have leprosy, so what other clinical findings will clue us into an infection? Well, you can do what's called a Lepramin skin test, which is an intradermal injection of bacterial antigens to test for the presence of an immune reaction. And of course, this is exactly how we screen for TB, which should really help remind you that this form of leprosy is called tuberculoid leprosy. And do you remember what symbol we used to demonstrate the skin test in TB? Yep, a shovel stuck into a mound of dirt, which is meant to look like a needle entering the dermis and the resulting wheal that forms. So we've thrown it in again down here. A positive Lepramin test means that a patient's cell-mediated immune response is intact and able to effectively fight the bacteria. Okay, now that we've talked about the tuberculoid infection, which is generally well controlled, what happens if the body can't fight the infection appropriately? Well, we'll move on to the second side, to jail cell number 2, to demonstrate the lepromatous presentation. The number 2 refers to Th2 cells being the predominant immune response, and if you remember from immunology, Th2 cells promote the humoral response. And people who get this form of infection have a very weak or non-existent Th1 response, and this really prevents its containment. So we'll symbolize this by having the prisoner in cell block number 2 breaking out and escaping from his cell, or cage, i.e. macrophage cage. So when you see this, think of bacteria breaking out and not being able to be contained within the macrophages. And to really make sure that you remember that this form causes a humoral response, we've made our prisoner laughing as he's escaping. This type is the classic leprosy that you probably read about in your history books, back when those poor, unfortunate souls who were infected with leprosy were actually shipped off far away to leper colonies to try to prevent the spread of infection. So it goes without saying then that this form of infection has a high chance of being transmitted from human to human. But the exact mode of transmission still isn't actually known, but it's been theorized that it could be via respiratory droplets. To remember that lepromatous leprosy has human-to-human transmission, just remember the escaped prisoner reaching out to grab our acid-fast gunslinger as he is about to jump on the back of his horse. Helps his friend escape from jail, and in return, his buddy gives him leprosy. So now let's get into talking about the symptoms. On our escaped prisoner, you'll notice that he's wearing some long johns, which cover up his extremities completely. And remember how I said that lepre prefers cooler temperatures? Well, the distal parts of our extremities tend to be cooler than our core temperature, so this actually correlates with the presentation of the neuropathy caused by the bacteria. It manifests with a symmetric neuropathy with this glove and stocking pattern. And we've mimicked this stocking glove distribution by adding these gloves and slippers that indicate where the neuropathy typically presents. And the infection also causes these numerous, poorly demarcated raised lesions. And these lesions can actually present all over the body, but most notably on the extensor surfaces. And we'll add some of these characteristic skin lesions to the extensor surfaces of our escapee. But you really shouldn't have to drill this in because it should somewhat be obvious. Extensor surfaces face away from our body, and thus would be cooler. So that makes sense too. And if you biopsy these skin lesions, you'll see large amounts of bacteria. And this is opposite from the tuberculoid leprosy, which, if you biopsied those lesions, there would only be small amounts of bacteria, again because it's pretty contained. Finally, lepromatous leprosy causes profound facial deformity, which includes thickening of the skin, the loss of eyebrows and eyelashes, the collapse of the nose, and formation of nodular earlobes. And together these are so deforming that patients with this feature are said to have leonine faces, because it supposedly makes them look like they have the face of a lion. We'll demonstrate this with our acid-fast gunslinger wearing a bandana with a lion's face painted on it. And that's it for presentations. I would like to mention though that although we discuss Mycobacterium leprae infection in terms of duality, these diseases actually present within a spectrum. However, test questions certainly could test your knowledge of these two opposite ends of the spectrum. Okay, now let's wrap up with treatment. Just like Mycobacterium tuberculosis, leprae requires multi-drug therapy for a long time. Since the two presentations differ so much, they do receive slightly different treatments. For the Th1 dominant infection, or the tuberculoid form, it requires dapsone and rifampin for 6 months. We'll illustrate this with a deputy carrying a rifle. We've added this deputy badge on the wall because deputy sounds kind of like dapsone, so that'll be your cue for that. And of course, he's carrying our reoccurring symbol, the rifampin rifle. Now, these two drugs are also used for the lepromatous form of infection. However, since it's a more severe infection, we actually have to add a third drug for treatment. So on the other side, we have another deputy and another rifle to represent dapsone and rifampin, but we've added a white cloth in the deputy's hand, as if he's surrendering. And we've also added this cloth escape rope. And all of this cloth is to represent the drug clofazimine. So cloth for clofazimine. And if you thought taking antibiotics for 6 months was a long time, this form of infection is so bad that it requires taking the triad of drugs anywhere from 2 to 5 years. And the deformities and neuropathies caused by the infection may not be reversible. Okay, that about covers Mycobacterium leprae. And the moral of this Western? Don't get leprosy.